Thank you for watching the Inside Out, a Step Inside Mental Illness series. If you have missed any of these episodes, just remember that you can see them on Lakes TV3's website, on the Inside Out, a Step Inside Mental Illness YouTube site, and also on the Becker County Energize website under the Hope Project. In place of a live panel, we've asked our medical providers to answer some questions, and so we're going to take a few minutes to answer those.
Changes in appetite, weight gain, or in some cases weight loss, are often signs of a more serious health problem. We know that overeating in particular can be a way that people commonly cope with stress. And so if you're noticing that you've fallen into a pattern here of unhealthy coping that you're finding is ultimately difficult to control, that is definitely something that you need to pay attention to. Take steps to try to curb that if you can, but if you are having difficulty controlling your appetite, if you're having difficulty eating healthy, if you're having difficulty starting exercising in a healthy fashion, and that is something that you can certainly reach out for. And I would encourage you to do so, because left untreated, that can lead to other serious psychological and physical health concerns down the road.
When someone is feeling like they need help, and maybe even wanting to get help, but reluctant to ask for help. So asking for help is a very difficult thing to do, because it makes you vulnerable, and you're already feeling vulnerable enough. And so it's really difficult to ask for help. And there's this idea that when you're vulnerable, that means that you're weak. And actually, when you're vulnerable and asking for help, you're showing a great deal of courage. And there's ways to ask for help that might be easier for you to do than others. I'm not sure, but you can let people know, I'm in a difficult place right now, and I really need some help. Can you help me? And just be open and honest about that. Is what I would suggest to someone who's really struggling. That the time when you're feeling like you want to ask for help, but you're not doing it because you feel ashamed, or you're embarrassed, or humiliated, or any number of feelings that people have when they get like that, is the time to reach out and to know that you're really being courageous by doing so. It's important to do things that might seem silly and like they wouldn't work, because they're easy, so to speak, to do. So make a list, make a plan. Here's what I need to do when I'm feeling like this. So if you're feeling like you want to sleep all day, or you're feeling like you need to talk to somebody but you're isolating yourself, you have this plan that when you feel like this, you call this person. When you feel like this, these are the steps that you are going to take. So you don't have to remember them. You can look at your list and you can do what your list has, and your list will have everything on it. If you're supposed to call somebody, the number will be right there. And you'll just do it, and not second guess or try to talk yourself out of it. That you've already made your plan, and there's the list of steps you're going to take, and then you follow it.
All right, so the question is about someone reaching out because they're feeling depressed, and they're getting a text back from their friend saying that they will pray for them, and no one came over, and the person's experience was that reaching out was lonelier than if they just would have kept quiet. And in this situation, I think some things that could have been done differently is thinking about kind of why are we reaching out to someone in the first place? And likely this is because of a desire to feel connected. I mean, as humans, we're hardwired for connection. It makes sense. And reaching out is a way to feel connected to someone, especially when we're struggling. So we kind of got the why behind it, and then it's important to think about what makes you feel connected and supported. And this really varies from person to person. Sometimes we just want people to know what to do, but we have so much more success when we ask directly for what we need, and what we need that person to do to show us that they're there for us. I know that can be such a hard thing to do when you're feeling depressed or stressed, but it's so much more successful. So this might be something like, I'm feeling really stressed and depressed, and I'm thinking about seeing a therapist, but I don't know where to find one. Can you help me find one? It might be something like, I have this doctor appointment coming up that's causing a lot of anxiety. Would you come to the appointment with me? If you just need a night in, asking your spouse, like, I'm stressed, can we spend the night in? It's just so much more successful when we ask directly for what we need.
I think it's really important for people who are living with a mental illness to learn to be an advocate for themselves and to be able to stand up for themselves. And so oftentimes people feel stigmatized when they have a mental illness. I think particularly in rural areas, in the Midwest, I think it's even more prevalent possibly. And there's this ingrained work ethic, which is amazing. That's a gift in this area that we live, but also people might respond, well, pull yourself up by your bootstraps and, just get up and, don't stay in bed all day, and thinking that it is within the person's control. And so something that the person can do would be to get started in therapy and learn how to, for one thing, foster self-acceptance and self-esteem. The other thing that's important would be to learn how to be more assertive and set healthy boundaries. And another great thing that they could do would be to role play possibly past situations where they felt like somebody was attacking them or said something inappropriate to them, and they weren't able to stand up for themselves, to kind of practice using that situation so that they would be better equipped moving forward to stand up for themselves. And that's also where an organization like NAMI, where they could connect with other people who are living, with a mental illness. They can share their lived experience. They can share what has worked for them, what hasn't worked for them. So there are many different things that a person living with bipolar disorder or a different mental illness can do to learn how to be their own best advocate.
If you know you need to get help for your loved one, the first thing to do would be to talk to them about you're really feeling like they need to seek some professional help, and start to broach that topic with them. And then the next thing I would say is to reach out either to your family doctor or somebody that can help you, and then look at maybe starting some either psychotherapy or see a psychiatrist. To get into therapy sometimes can take a little while to access, but what I like to tell our patients is that we have the availability, not only here where I'm located right now, but most of us are licensed in both North Dakota and Minnesota. So if you are doing the telehealth option, we can really try to get you in as quickly as possible with one of our local or close to local providers. We also still do in-person appointments if people feel uncomfortable, or someone in your family doesn't want to do something by video, they prefer to be in person. We still do offer the access by in-person visits. And then if we can't get the individual in, we will refer them or get them connected with a community resource that can start right away or as soon as possible to get services going for them. Because I know that, especially right now, people are accessing more mental health, and that's great. That's exactly what we want, but we want to make sure that we try to make things as accessible and easy as possible to be able to get those services.
Okay, so another question that is commonly asked of me is what happens if I am worried about a farmer who is showing signs that they're emotionally upset, and I'm worried about potential suicide, but anytime I try to talk to them about it, there's that gruff kind of answer, I'm fine, and the door is shut, and I'm not able to get anywhere with them. And that is hard because like I said, farmers are a tough group, and they aren't, they'll talk all day about aches and pains and injuries and surgeries, but they're not going to talk all day about their mental health. And so to get somebody to open up about the hurt they may be feeling emotionally doesn't happen unless you have a very good trusting relationship with them. So I just encourage you, if you are reaching out to them and you're not getting a reaction that's getting you an in or an indication of if they're okay, is there someone else in their life that has a more close relationship with them that you could go to with your concerns, and maybe they could approach that person? Another strategy is that when you approach them, be sure you're doing it out of a sense of concern and caring, and indicate what you're seeing that leads you to be concerned. So whether it's you notice they've not been erect, or that they're missing milkings, or whatever is indicating to you there's a problem, formulate a way to tell them that out of caring and concern. And just say, I'm just wondering, do you need help right now? Is there something that we can do? And just try to be open, just like you would if they were struggling from a physical ailment and couldn't do everything they needed to do on the farm. Approach it with the same openness, the same care and concern. And then again, if you're not getting anywhere, is there a pastor that they trust? Is there a spouse or an adult child in their life or a sibling that they may be more connected to and willing to open up?
I guess if you're not sure, it's always best to act with caution. You don't ever want to regret not doing anything. And if you truly believe that a person is at risk of suicide because of either threats that they've made or behavioral changes, such as they're giving away personal possessions, or there's a marked change in their mood, I would always err on the caution of reaching out for help. If it's an adolescent or a child, I would reach out to their parent and express concern to them and let that parent make those decisions. If it's an adult and you're concerned and they won't agree to call the crisis line, they won't agree to go to the emergency room with you for an assessment, then I would call law enforcement. It's just not worth the risk of something happening and then you having great regret about that. And if law enforcement comes to the home or meets the person where they're at, wherever they might be at, they usually do a really nice job at assessing the person's safety, and they can make that determination of if they need to facilitate extra assistance, such as law enforcement might call the mobile crisis team to reach out for support from the crisis team who routinely do assessments for safety, and then that crisis team can either work with that individual to de-escalate the situation and make sure they're going to be safe at home, or they can help them get to the emergency room so a doctor can assess them and make sure that they're safe, because that's what's important. I would much rather have a friend who's safe than a friend that's not here.
So in terms of talking to a teenager who is somewhat difficult to engage, there's a few things to kind of think about. The first is, timing. Timing is everything. When you're talking to teenagers, you want to take a step back and notice when your teen is most receptive to talking. Is there a time, for just the two of you? Do they have a tendency to open up more, during family dinner, or is it too much of a rush to expect to all eat together? Many parents find that, although it can be wearing to be the family chauffeur, drive time can be a good time to connect. Other teens will seem to open up at dark when the day is winding down. So you want to think about when is your teen most receptive to potentially having a conversation and go from there. Another rule is try not to take things too personally. Okay, if you initiate a conversation with your teen and you get rebuffed, again, it can be hard, but after long years of parenting, we can all feel pretty tired at times. By the end of the day, there's just challenges that are difficult to confront. If you feel like your teen is just in a negative state, that might not be the best time to approach it. But if they begin talking, you want to listen. Listen until they stop, rather than jumping in with a comment or a thought. As parents, we often want to fix things right away, but sometimes it's just best to listen and validate where they're coming from. Look for laughter and join in. Laughter is a great tension dissolver and a connection builder. Once you've had some fun together, you might find that your teen might be more receptive to talking. Sometimes just sit and hang out, be present. And the more present that you can be with them, and that means putting down technology, the more present you can truly be. You might find that over time, once the atmosphere is warm, you'll be able to get their attention, and they might be more willing to start a conversation. Another thing that I talk to parents about is try to avoid asking a lot of questions. And this might sound counterintuitive, but if your teen has fears about judgment or you often argue, they might not want to open up. So you want to avoid asking those questions. And again, you want to nod or just validate where they're coming from and say, well, that must have felt hard, or, oh no, that happened? Oh, I see. I understand why you feel that way. So really working to normalize and validate where they're coming from, as opposed to arguing or trying to fix things, can be a great way to help kids be more willing to engage in conversation. And then, let them take the lead. Teens right now feel a heavy weight of control in their lives, and giving them opportunities to take the lead and how they want to spend their time with you can really help them open up and talk. So setting aside some regular special time can be helpful. Gives you opportunities to hang out casually, avoid the need again to ask a lot of questions. Again, focus on the enjoyment of what you do together. Again, it's true that teens are going to often rebuff the notion of spending time like this together, but over time, if you can work to build that positive relationship, you're going to be much more likely to converse. I often will tell parents, it's your job to open the door, and with time, your teens will choose to walk through and engage.
You might have a lot to be angry about, but maybe try to step back from the situation, take a deep breath, and what is underneath that anger? Because a lot of times anger might be the emotion that's expressed, but the emotion underneath it is fear. We have lots of fear, for our family and other people that we care about. And if you're a person that's seen someone you love overdose even a few times, or you're worried that you're losing them to drugs, it's really a fear, and it's a fear of losing someone you love. And it's okay to tell them that. It's okay to say to them, I'm really upset by your drug use. I'm really upset that you're not taking your mental health medications. Whatever it is that's bothering you, tell them. Let them know that, and tell them what you're afraid of. I'm afraid I'm going to lose you, and I don't want to do that. And that will, be real, be genuine with them, and they will hear that. They might not do what you want them to do right away, but it will be there, and you will have said that, and it will be important to them.
With this question, I think it's so great that your friend told you that they're stressed or depressed. the takeaway from that is they want to know that you care. They're maybe not feeling ready or comfortable to talk with a professional. That possibly is why you got that upset and reactive reaction from them, because going to professional might seem like a really big step. And oftentimes there's this misconception that going to professional is only necessary when things are going like really, really bad. So it can be pretty intimidating to a person. I think a better first step for you would be to have an open conversation with them about, what's stressing them out, what's their experience of depression, what do they think would help. It's also really good to be specific with how you can support them. So asking a question like, what's stressing you out the most today that I can help you with? Or what could we do together today that would help boost your mood? And then if you continue to notice these things with your friend, like them feeling depressed or stressed, bring it up at a later time and say, I notice you're continuing to feel stressed and depressed and you're just not seeming like yourself. I know last time when I mentioned it, you said no, but would you ever reconsider seeing someone who's trained in treating depression and anxiety? I could even help you find someone. I could go to the first appointment with you together. So yeah, trying that approach is a lot more softer and less intimidating for the person.
It's really important to be able to differentiate between sort of a situational stressor that could cause more anxiety or depression versus when whatever medication, or perhaps the person isn't on medication, how to know if it's the disease or if it's a situation, or it possibly could be both. Right now with COVID-19 and the quarantine and the distancing, people are having a difficult time with feeling isolated and just are reporting more anxiety, more depression, and things like that. And so I think it's important to thoughtfully work through the timing. Like when did you start to feel more anxious or depressed? Does that line up with a fight with a loved one, maybe getting laid off from your job, significant financial stress? Is it lining up like time-wise? Did it come on suddenly? Did it come on slowly? That's important to consider. Are you yourself the only person noticing it, or have other people in your life made mention of, gosh, you seem quite a bit more irritable, or you just seem sad all the time, more depressed? So there's many different ways to kind of work through that. A medication change is not always the answer. Sometimes it's best to focus on healthy lifestyle choices, getting adequate variety of nutritious foods, exercising, getting good rest, avoiding drugs and alcohol, going to therapy, those kinds of things. But then there gets to be the point where things are really trending in that direction of, the person not feeling good, not being able to function in their life as they once had. And so at that time, it's important to probably talk to your medication provider and see if a change in medication might help some of the symptoms.
That's a tricky question. There's no perfect answer, but if you know what helps them adjust and cope, those would be things to start with and help them realize that if it is just temporary, that it's temporary, that it's needed for a little while. If it's long-term, another resource would be if there's a social worker right on site at the nursing facility to access the support there. Try to get them involved either by Zoom or by other options with the family that's outside the facility so they don't feel alone. This has been especially challenging with COVID for people who are isolated and at the nursing facility. So if there's a way to bring by their favorite snack, even if you can't go inside, but some nursing facilities will let you leave it outside and they'll pick it up and bring it to them. Trying to find ways to make them still know that they're thought of is a very important way of helping them be feeling included, loved, and still appreciated. And then also watching for the symptoms of depression. So if you know that they are transitioning into a facility and their behavior, the way that they interact with you, the way that they keep themselves up, if they're starting to not want to talk on the phone, if you see any other significant changes, those would be excellent times to talk with the social worker or the physician that's following your loved one at the nursing home, so they can look at if they need to add medication or if the patient needs one-on-one help with the professional clinician or social worker that's on the site at that time.
I guess in recap, my greatest message to my farmers and their families is to not give up. Not give up hope, not give up knowing that there's life worth living, because there's always, even if things are difficult, it will be different in a week or a month or a year. Something will be different, and you just need to hang on to experience that. You have a purpose in life, and it may not be going exactly the way you want it to go, but just hold on. Don't give up. Reach out for help. Don't be afraid to ask for assistance or help for yourself or your family. Really just be okay with being vulnerable and reaching out for help.
Sometimes we can feel very powerless in relationships where we don't have control. If we're a young adult and our parent isn't doing well, or if we're in a partner relationship and our partner isn't doing well, and we really want them to get help, we see that they're suffering and they just refuse. They're not ready. They're not ready, or they're afraid, and they won't do that. So it's hard. It's hard. What's important to do, though, is, again, just really express your concern about them. Express how you feel, seeing them suffer. Because sometimes when people are suffering so much, they forget about others, and they forget that other people feel too, and they might need that reminder that we feel sad when we see them on the couch all day long, or we feel scared when they're yelling at us so much. And when we can express our feelings and describe their behaviors and our concerns about them, sometimes that will motivate them a little bit more to get that necessary help. But that doesn't always work either. And that's when, if it's not a situation where it's an emergency and we can't make them get help, then that means that we really need to work on self-care for ourselves and acceptance that we don't have control over them. We care about them, but this is something that we can't make them do. And sometimes we just have to let it go and come back to it again a little bit later.
One of the best things you can do is just be present and listen. We tend to think of people needing help as being broken and needing to be fixed. You literally cannot fix another person, and that person isn't broken. They're hurt and they need healing, but they do not need to be fixed. And so we need to take the shame and the blame and the humiliation out of people getting help and getting assistance. And a lot of times people just want to be heard. So if you'll just be present in their lives and listen to them without judgment and without needing to fix them, that will be the best thing you can do for them.
We want to say thank you to our main sponsors who made this series possible, including Northwestern Mental Health Center, White Earth Mental Health, Sanford, Lakeland Mental Health Center, Becker County Energize as a program of Essentia Health, and thank you to the many other sponsors and those who participated in the series. We are so very grateful for those who shared their stories to help others break stigma and silence when it comes to helping promote mental health and support. We truly hope you take the opportunity to watch this series, Share it with your loved ones. Go to the Becker County Energize Hope Project website and look through the resources that are available to help you. It includes all of the resources for Becker County and White Earth mental health, Q&A on mental health and substance use, and suicide questions if you don't know how to talk about that issue. Once again, thank you for joining us, and we hope you truly enjoy the series, and please share them as a tool to help promote mental well-being.